Fortunately, pancreatic cancer is a rare kind of tumor that occurs in India, but it is a deadly cancer. We must understand the incidence of the disease, the symptoms, and the main management concepts. Hi, I am Deeksha Kapoor. I am a gastrointestinal surgeon at Medanta, the Medicity, Gurugram, and I will be telling you a few things about pancreatic cancer today. In India, pancreatic cancer is a rare tumor, but the incidence over the last 10 to 15 years has been increasing. We see it more commonly in men than in women, and if I were to give you a rough estimate, about 2 to 5 patients per 10 lakh population will develop pancreatic cancer. But in the last 10 years, the incidence has gone up by about 20%, and it is estimated that about 14,000 to 16,000 new cases of pancreatic cancer develop every year in the country. Like I said, it is a deadly cancer. The early patients don't have many signs and symptoms, and most patients coming to the hospital have advanced disease. Only about 20% patients who come to us in the outpatient clinics have a tumor which can be treated upfront by surgery. So we must understand the risk factors associated with pancreatic cancer. Though a small group of patients may have familial disease or may have history of cancers in their family members, but the most common association is cigarette smoking. Other factors which have been found to be associated are obesity and long-standing diabetes. Especially in patients who are in their 5th to 6th decade of life, who are obese and who have long-standing diabetes, if on follow-up the doctors find that their sugars have suddenly gone haywire and they have increasing requirements of insulin, it makes sense to screen them for pancreatic cancer. Other patients in whom there is a family history of the same tumor or certain syndromes like Reformoni syndrome, etc., it makes sense to screen these patients for pancreatic cancer. Most patients, like I said, will come to us in advanced stages of the disease, but a small group of patients in whom the tumor in the pancreas is located in the head or it compresses the bile duct or the ampulla. The ampulla is that segment into which the bile duct from the liver, the pancreatic duct from the pancreas, and the small intestine join together. In these patients, the symptoms develop early in the disease and they end up coming to the hospital in time. In other patients, the symptoms are rather vague, like upper abdominal pain radiating to the back, weight loss, and loss of appetite. And therefore, patients often come to the hospital when it's been late. So when you go to the doctor with symptoms like these, usually the first investigation which is done is an ultrasound of the abdomen. And depending on what is seen, we decide whether the patient needs a CT scan or an MRI. Depending on what kind of tumor is seen in the pancreas, and if the surgeon feels that the tumor can be removed upfront, the main modality of treatment and the best step forward is a surgery. But in some patients in which the tumor is advanced, that is, if it is stuck to the vein or the artery going through the pancreas, sometimes we prefer giving these patients chemotherapy first. We don't often believe that all patients with pancreatic tumors need biopsy. If the CT scan picture is suggestive of a cancer and the tumor can be removed, that is the best treatment forward. But if we feel that the tumor is big and requires chemotherapy before surgery, that is when we want to prove it with a biopsy and then move forward. Having given this information to you, I really hope that none of you see us in the hospital with this disease, but we are here in case any help is required. Thank you.